I'd like to introduce you to 5 key areas of research that we have available here for patients that is not directly all related to patient care, but also extends our understanding of pediatric epilepsy as a whole. The first has a direct patient result, and that is outcomes-based research. We make available new clinical pharmacology trials for our patients, new medications, new procedures. We also continue to look at the outcomes-based research for the procedures we provide, such as the pediatric epilepsy surgery that you will see in this webcast. The second type of research are NIH-sponsored larger outcome studies. In these studies, we partner with the top pediatric epilepsy programs, not just in the nation, but worldwide, to look at improving the treatment protocols for patients with infantile seizures, status epilepticus, first-time seizures, to again optimize the treatment on a very scientific basis for patients as they present. The third type of research that we're very, very excited about here at Weill Cornell Medical Center and the Komansky Center for Children's Health is the genetics of pediatric epilepsy. This has been an explosion in our field in the last few years, and we feel that it's going to make drastic changes in how we see patients, how we treat patients for the future. Many of our epilepsy syndromes in pediatrics present due to the genetics that the patient carries. These can turn off and turn on in various times, and we are just at the cusp of understanding the underlying basis of these genetics of epilepsy. A fourth type of research that we do in collaboration with our colleagues. You've already met Dr. Schwartz and Dr. Greenfield, our neurosurgeons, and we have a very, very active collaborative research program on brain tumor research, on other forms of research that we have in conjunction, looking at why, for example, certain brain tumors cause epilepsy, what we can do to stop that process, why do certain forms of brain injury lead to epilepsy, and what we can do to stop that process as well. The fifth and final area of research comes from computational healthcare research. What is the effect of having now more electronic medical records? Are we able to provide more efficiency of care with patients having their medical records available to electronic systems where they can be accessed through multi-institute systems? We're looking if this can help optimize patients, obviously epilepsy care, and later perhaps we can expand this care and looking at their care for other conditions. One of the huge advantages of the Pediatric Comprehensive Epilepsy Center at the Komansky Center for Children's Health is that we are in direct proximity with our basic scientists. Many of us work in close collaboration, and we can translate those new findings directly into our patients' care and directly for our patients' health.